Hi, good afternoon. I would like to welcome everyone to our town hall sponsored by CPUP and the Anti-Racism Committee. Thank you all so much for joining us. I would like to first introduce our Chief Medical Officer, Dr. Neil Fishman, who is going to start by sharing some information with us about the vaccine, its effectiveness, and its safety. Dr. Fishman?
Hi, good afternoon, everybody, and thank you for inviting me. May I have the next slide, please? So I'm going to give a very brief background about COVID-19 and then spend most of the time talking about vaccines, including just a general background about vaccines, because I heard that the audience was interested in learning what we know about all types of vaccines. And then we'll dive into some specifics about the COVID-19 vaccine. Next slide, please. So COVID-19 is an infection that's caused by a virus that's been called SARS-CoV-2. As of last night, there were 23.3 million infected people in the United States, with a death rate of about 1.8%. And 1.8% may sound low, but as of last night, over 388,000 people had died from this infection in the United States. It is very clear that this infection disproportionately impacts Black and Brown communities, with the death rate of somewhere between 2 to 3 times higher than in the white community. It's important to know that this is not due to genetics. This has its basis rooted in systemic racism in our society and to a long-standing history of inequity in healthcare in the United States. And I'll talk a little more about that later. There has been a new strain of the virus detected in the United Kingdom and in South Africa. This strain appears to be more easily transmitted, but the disease is no more severe, and these new vaccines still cover this strain, and the strain has been detected in the United States. Next slide, please. So what do we know about the COVID vaccine? Next slide. I want to focus first on the diagram on the right, which is a little diagram that shows how all vaccines work. What vaccines do is they present some form of the germ to your body. And your body then develops an antibody response, and the antibodies are indicated in this diagram by the red Ys. These antibodies act as a shield if you do get infected by the actual germ. Now, these germs can be presented in a lot of different ways in different vaccines. For instance, there are some vaccines where the germ, or usually a virus, is dead or inactivated. And that's the common way the influenza vaccine is made. There are other vaccines where we administer an attenuated or wimpy or weak form of the virus. These are actually live virus vaccines, but they don't actually cause disease. And the best examples of these vaccines are measles, mumps, rubella vaccine, and also the chickenpox vaccine. And then there's some other vaccines where we administer part of the germ, maybe a protein that's on the surface of a germ, or some other type of component of the bacteria or the virus. And this is the way the whooping cough vaccine is made, and also the shingles vaccine. And then finally, there are some vaccines that administer toxins or toxoids that some of the germs can make, like tetanus, for example. And they're administered in very low doses, so that your body can learn to fight that infection if you're ever exposed to tetanus. Now, the messenger RNA vaccines are the technology, or is the technology that's used for the COVID-19 vaccine. Next slide. So right now, there are 2 different messenger RNA vaccines that have been introduced in the United States under an emergency use authorization to fight COVID-19. This insert here is when we received our first shipment of the Pfizer vaccine. which was the first vaccine we received on December 16th. And what I love most about this picture is that the UPS guy was just as happy to be delivering it as we were to receiving it. They're both messenger RNA vaccines. The Pfizer vaccine requires cold storage at minus 70 degrees. It's a 2-dose series that are administered 21 days apart, and you do need to give both doses to be protected. The Moderna vaccine is also an mRNA or messenger RNA vaccine. Storage is a little easier. It has to be stored in a regular freezer at minus 20 degrees. It's also 2 doses, but those 2 doses are administered 28 days apart. Next slide, please. One thing I do want to mention is that we now have both vaccines available, but people cannot choose which vaccine they receive, and that's because we don't want to waste vaccine. Each vial of the Pfizer vaccine provides 5 to 6 vaccines, and each vial of the Moderna vaccine provides 10 vaccines. And each of them have to be thawed for use. So if we start mixing them and allow people to choose, we run the risk of wasting vaccine, and we really can't afford to do that. Additionally, both vaccines have equal efficacy. They're both 95% effective. So how do these messenger RNA vaccines work? Next slide, please. It's first important to know that these messenger RNA vaccines are not new. They've been in development for 10 to 15 years, and the basic technology for these vaccines was actually developed by one of our faculty, Drew Weissman, about over 10 years ago. So the work on these vaccines has been going on for a very long time. Messenger RNA is a blueprint for proteins. And what you can see in the diagram in the upper right here is a little portion of the messenger RNA of this virus, this coronavirus, the red portion, which encodes for the spike proteins, the red spikes coming out on the surface. And what this vaccine does is it helps produce antibodies against that spike protein. The vaccine puts the mRNA in an oily shell, and it's important to put it in that shell because if you would just try to give the body messenger RNA, our bodies would chop it up into pieces immediately. Next slide. When the vaccine's injected, that little oily shell puts the messenger RNA into our own cells, and our body uses this blueprint to make small pieces of the spike protein and put them on the surface so that our body can start to develop an immune response to the vaccine. Next slide, please. So our body develops the immune response by developing antibodies. It's also important to know that the messenger RNA is destroyed after our body uses it. It is chopped up once it's outside of that oily shell. And the antibodies are then available to fight against the infection. A lot of people feel or ask whether this was rushed to market, and I wanted to point out, first of all, once again, that we've been studying these vaccines for 10 to 15 years, and also that it was very easy to do the clinical trials because the disease is so prevalent in the community. Next slide, please. So one important question is whether or not this vaccine works. And it is undoubtable that the vaccine works extremely well. This is the most impressive clinical trial result that I have ever seen. If you look at the curve on the right, the way the trial was run was that individuals either received a placebo or fake vaccine or a real vaccine. The blue line shows what happened when people got placebo. They continue to get COVID-19, whereas if they received or when they received the real vaccine, there was a difference that we started to see at 10 days. And what this graph shows is that the vaccine was 95% effective in protecting against COVID-19. And this is true for both vaccines. The one thing we do not know yet is how long this protection lasts, and it'll take some time to figure that out. Next slide. There's several myths about this vaccine I would like to debunk. The vaccine does not contain a live virus at all. Therefore, it is impossible to get COVID-19 from the vaccine. The messenger RNA does not get integrated into our genes at all. And it's actually destroyed after it's used. There are no tracking chips in this vaccine. Now, I have gotten the vaccine. My wife always knows where I am. She always knows where our children are, but that's because she's been following us by our phones for 10 years. It has nothing to do with the vaccine. There's not a tainted vaccine that's being distributed to the Black or brown community. There is a single vaccine that's distributed to everyone. And then finally, the vaccine cannot and does not impact sterility. Next slide, please. Is the vaccine safe? I'm going to show you some numbers about vaccine safety. There are some mild to moderate side effects. They usually occur after the second dose, and the most common side effects are fatigue, headache, and muscle ache that's seen in about 60 to 75% of people. About 17% of people develop a fever, and the symptoms usually improve in about 24 hours and can be controlled with either Motrin or Tylenol. What we do when we administer the vaccine is observe everyone for about 15 or 30 minutes. And if people develop a reaction or a bad reaction after they leave the vaccine site, they can either come back to the site or call occupational medicine. It is important to know that no one has died from the vaccine. I do know that there is one case under investigation in Florida, but that death occurred 16 days after the vaccine was administered. And if a death was actually due to the vaccine, we'd expect it to occur much sooner. Next slide, please. Just wanted to give some facts looking at comparing the risk of an allergic reaction to the vaccine to the risk of dying from COVID. About one person for every 100,000 people vaccinated will develop a severe allergic reaction that's not life-threatening. The mortality rate of COVID-19 is much higher, and as I mentioned, this infection has a predisposition for our Black and brown brothers. What you can see here is that the death rate per 100,000 in white people is 95, whereas it's around 230 per 100,000 in our Black and brown populations. Therefore, a Black or brown person is greater than 200 times more likely to die from COVID than they are to develop a severe reaction to the vaccine. So far, at Penn Medicine, we've administered 39,000 doses, and that includes both first and second doses of the vaccine. This has all been to people who work at Penn, and we hope to start administering vaccines to the public within 1 to 2 weeks. However, there's a significant disparity in people's willingness to get vaccinated. As you can see here, white people have accepted, about 70% of white people who are offered the vaccine have accepted the vaccine, but only 30% of Black and brown people have accepted the vaccine. And I do want to spend a little time talking about that, but I do have to point out that the population that is at greatest risk of dying from COVID have not been accepting the vaccine. And next slide, please. So should you get vaccinated? As you might imagine, I feel pretty strongly about this. I have seen too many people die alone from this disease. I've seen too many families grieving alone from this disease. I've seen the impact that this disease has had on my colleagues, on all of you and your families. I've seen the impact that it's had on our children and on their education, and I've seen the devastation that it's had on our economy. I believe in this vaccine. My wife works at another institution. She received her second vaccine on January 8th, her birthday. I received my second vaccine this past Monday, on the 11th. And that young woman getting vaccinated in this picture on Wednesday is my daughter. And she got her first vaccine on Wednesday. So I believe in this vaccine enough that I allowed my daughter to get vaccinated. I really believe that this is the light at the end of the tunnel. And I'm asking you to help us make this the beginning of the end of this infection. However, I understand why my black and brown friends, my black and brown brothers are skeptical about this vaccine. There is a long history of systemic racism in our society, and we need to look no further than January 6th to see what that looked like. And some people looked at January 6th in DC and said, well, that's not who we are. But I'm a little concerned that it is who we are, and that it was emblematic of the oppression we've seen of systemic racism in our society. We know what those pictures would have looked like if that was a Black Lives Matter march in Washington, D.C. And we can draw a straight line from what happened in D.C. to your feelings about the vaccine. And I stole that from Dr. Polite, who tweeted it. I have to admit, who tweeted that point. Kneeling in a field for 8 minutes and 46 seconds was a very good start for us. It was a very good first step, but it can't be the last step. And I'm asking you to help us take the next step and help this be the beginning of the end. We also have an embarrassing history and an even more embarrassing present of racial injustice and racial inequity in healthcare in the United States. But this is an opportunity to take a first step towards eliminating that disparity. And I'm asking you to take that step with us and to make this the beginning of the end. Thank you.
Thank you so much, Dr. Fishman, first of all, for your continued advocacy, for your continued work to end the health disparities that we know are a major part of systemic racism, and for doing it so honestly and so authentically. So thank you. Thank you for all the information. You all, I have tried to manage the chat in real time. I'm now going to be moving to moderator and presenter, so I may not be able to get to all of your questions. Thank you so much for those of you who sent questions ahead of time, and those are the ones we're going to try to focus on today. But I also have a look at the chat, so just know we're trying to manage both. First off, I want to thank our panelists and to introduce everyone here, and then we will get started. Obviously, you all have already heard from Dr. Fishman, who is our CMO, who's integrally involved in vaccine rollout across HUP, but really has been such a partner in this work on vaccine advocacy. Next, we have Dr. Meghan Lanefall, who is a physician and scientist in critical care and anesthesia, who's also very passionate about vaccine advocacy, and we're so lucky to have her here today. We have Nicole Brown, our LPN from the Helen O. Dickens Center, who has been an asset to our patients in the number of years she's here. And what I love most about this is that I get to see Nicole's smile, which I have not seen since we have been masking, but her smile is well known in the Helen O. Dickens Center. We have John Dixon, who shares his culinary skills with our patients as a Pavilion cook, and we are so excited to have him here today. And last but certainly not least, we have Kenya Pitt, my fellow Philly girl and human resources specialist and co-planner of our town hall today. So I do just want to take a moment to thank our obviously Kenya Pitt, but also the Anti-Racism Committee and their support of this town hall. So first, we're just going to go ahead and get started. Each panelist, I'm going to ask you to share with us your initial feelings about the vaccine, what went into your decision to get the vaccine, and what were your side effects, if any. And Kenya, we're going to start with you.
Sure. Well, happy Friday, everyone. I'm grateful for all of you to be here. I'm very excited about you joining. So just leading with, opening up with the question that Rennie asked, what was my initial hesitation and thoughts and concerns about the vaccine? And so Neil addressed this earlier, right? And it really does center on what our relationship as African-American people of color in general, what our relationship has been to healthcare in this country, specifically when you think about other experiments in the past, like the Tuskegee study, and you think about Henrietta Lacks. So there hasn't always been a positive relationship. And so naturally, I thought on those things, and I thought about what the experience has been just as a patient, sometimes feeling a little disenfranchised, not really listened to or taken seriously. And it made me have, if I'm being really honest, a lot of hesitation about taking the vaccine. And my initial thoughts were, has the vaccine been well studied? Coronavirus has only been around, but for so long, how much time have scientists really had to really dig into this vaccine and study it in a way that will make me feel confident about taking it? I don't want to be a guinea pig. And I've heard that echoed in my own community, among my friends and family. And so that really was my initial hesitation in choosing to whether or not I wanted to take the vaccine.
And Kenya, where are you now in your vaccine journey?
So I have already received round 1 of the vaccine. It's been a positive experience for me. I have not had any real side effects. I've had a little bit of arm soreness, but I work out a lot, so I wasn't sure if it was from the vaccine or from working out, but it really wasn't that bad. Quite frankly, it was a non-event for me in taking the vaccine. And I am scheduled for my second round of vaccine and plan to do it as soon as possible. And I'm excited about it.
Thank you. Nicole, we're going to head to you. Nicole, you're on mute. You're on mute. We see your smile.
Hello, everyone. Okay. My hesitation with the receiving of the vaccine was my fear. I didn't know what kind of products that were used to produce the vaccine. And just like Kenya stated, I didn't want to feel like a guinea pig. And I think the whole thing of it being new is uncommon. So it did draw some form of anxiety. But the more I start seeing my colleagues get it, and I'm like, okay, no one had any issues with it. So I was like ready. Also, what I had to sit back and think about it because I did have coronavirus. And, the symptoms that I did go through with having the coronavirus was challenging. So I don't want to go through that again. So I decided, you know what, just go ahead and do it. You see the numbers are increasing, that people are receiving the vaccine. So that encouraged me even more. So I did it. The vaccine, my thoughts about it in regards to receiving the injection, I was a little hesitant in regards to that too, but it did feel like the flu shot. It did hurt or like a dull ache for about 2 days afterwards, but that was it. I felt fine. So I look forward to getting my second shot in a week and a half. So be hard.
Dr. Lanefall.
Thank you. So I'm a scientist, and many of you may not know I'm from inner city Chicago, and science was the thing that got me out of the hood. So I am on board with science. That being said, this vaccine is new, and I know that most vaccines take about 4 years to develop, if not longer. And so the idea of taking a vaccine that was developed in less than a year did give me pause. So as soon as I heard that vaccine efforts were underway, I wanted to know more about what was happening, what type of vaccine it was. And so I dug into information very early to understand what type of vaccine was being produced, what is an mRNA vaccine, what are the implications of it, and who are they recruiting really? Because when you look at who's participated in studies traditionally, it's not necessarily folks that look like us. All of my questions were answered to my satisfaction. I know that thousands of people, tens of thousands of people, got the vaccine before it ever got emergency use authorization from the FDA. And so I was ready to go. And I was in one of those early groups. I've gotten both of my vaccines. The first one I didn't feel at all. I actually thought they might have missed or something because I didn't feel anything. The second one, I did get a lot of arm soreness, and I was just tired for a couple of days. So I got it on a Friday evening, and I told my girls, I said, Mommy's just going to chill out this weekend. So lots of Netflix. I just hung out. That was this last weekend, and I feel fine. So that's where I am right now. But I'm glad that we're having this conversation because it's a really important one.
Thank you. John Dixon, unmute yourself, please, so we can hear your voice. Thank you.
Hello. Can you hear me?
Yes.
Hi. First of all, I would like to say I'm one of the chefs of the Pavilion. Don't get me wrong. I'm not just a cook.
Oh, I love it. I'm so sorry, Mr. Dixon.
I can make anything that you could possibly think of. So, first of all, I just want to clear that up. So, yes, I was a little hesitant and doubtful about the vaccine, but then I started looking around. I've been working here at the University of Penn over 30-something years, and I've seen a lot. I've been through a lot. And, we kept on the Black Lives Matter movement in the kitchen. We was wearing our shirts during the holidays and, going outside, taking pictures, posting of Black Lives Matter. And they think that I'm the leader of the, people in the kitchen, but I'm just one of the participants of the things going on in the kitchen. And I look at the vaccine and I start asking myself, what's the alternative? I look around the hospital, I see all these people dying. I walk out the back of the hospital. It used to be a cold storage out there, this is the honest to God truth, so, I travel a lot. So, I have to get COVID tested before I leave, when I get back, so I'm like, this is getting old. We have to move forward, as a Black community, especially, so I said, I'm the poster child right now of the vaccination. They posted around in the kitchen and different places and stuff like that. And people come and ask me. I brought maybe about 8 or 9 people over so far. And, and I tell them, I said the side effects when I first got it, I felt a little burning. That was it. The second one, it didn't bother me at all. So, it's to each his own. I said, if you have any underlying issues, you might want to think about addressing that first, and then, but I suggest to everyone, be vaccinated. We need to move forward. We need to get past this. I watched my aunt pass away, and my mom's only sister, and holidays, we couldn't be around my mom. I didn't want nobody around. I'm a mama's boy. I just want to let you know. I didn't want nobody to be around her. She wanted to have Thanksgiving and this and that like we've been doing traditionally. And I'm like, no, we can't. It's not until everybody gets vaccinated, everybody be safe. So that's the reason why. And like I said, I got both vaccinations, and I feel great.
Thank you so much, Chef Dixon, not just for your commentary, but also for the advocacy and working to actually get folks. Sometimes we have to do hold hands, right? We actually have to walk people out.
Walk them over here. Yeah, walk them over here. They went through the process with them.
That's awesome.
Yeah.
Thank you.
Mm-hmm.
We're going to get to a couple of our questions. Meghan, easy question. Where do individuals go to find out any stats or information on the trials before deciding to take the vaccine? People who want to do the research themselves.
So it's going to sound silly, but I would start with the CDC, the Centers for Disease Control. I've looked through their website. I've looked through a lot of information, and there's a lot of misinformation out there. There's also a lot of jargon that's very hard to understand. And what I like about the CDC's website is that it's written in plain language. It's easy to understand. There are a lot of links. And so if you want to dive into the science, you can get to those papers from the site. But I would start with the CDC. And this morning I Googled information about COVID vaccine, and the first link was to the CDC's website. So I would start there, and they'll give you information about the vaccine, about the trials. They have frequently asked questions so you can dive into, and some of them are the ones that we've talked about today.
Great. Kenya, what is the process if someone feels like they can't come to work after they receive the vaccine?
So for all employees who receive the vaccine, whether it's the first or the second, if you develop any symptoms that cause you to be absent from work, your manager would need to use the COVID leave in your timesheet to cover that time missing from the office due to experiencing sickness or illness as a result of the vaccine.
Great. And Neil already covered in his presentation, what do you do if you feel sick while you're at the center? They actually monitor you longer. If you leave the center, you can either go back or go to occupational medicine. Neil, another question for you. Can you give us an idea of the timeline for when the rest of Penn Medicine staff will be able to be vaccinated, and then moving on to the public at large?
All of the staff at Penn Medicine should receive invitations for the vaccine by next week. We'll be finished with invitations by next week, and then we hope to start offering to the public in another week or two.
Great. Perfect. We're going to stay with you. If the national policy changes and the vaccine stock is released to the public, will there be enough on hand for the second doses for those who have already gotten the first?
Yeah, we're taking that into account. Up until now, second doses have been withheld and were promised shipping. If the policy changes, and we still have to see what's going to happen in the transition from the Trump to the Biden administration, but if the policy changes, we will put half the vaccine aside to make certain that we always have second doses to administer.
And that's important for us, Neil, in the sense of one dose we know does not actually give us real immunity, which is why
Correct.
We know people make that.
After one dose, people only had about 54% infection, and you needed to get the second dose in order to reach 95% protection.
Great. Meghan, I have two more logistical questions for you. One, how long should you wait between COVID infection and getting the vaccine?
90 days, 3 months. And if you have been infected with COVID, we do recommend, as Ms. Brown said, we do recommend that you get the vaccine. The immunity that results from the vaccine is likely to be much more long-lasting than that natural immunity. There's still a lot that we don't know, but you should get the vaccine if you've been infected.
Great. And Meghan, and Neil touched on this, but I'm going to stay with you on this, which is why is it important to address systemic racism when discussing vaccine hesitancy in the Black community, as opposed to just saying we have folks who are hesitant to get the vaccine?
You gave me the easiest question. So we all know that the differences that we're seeing in uptake of the vaccine are related to the mistrust that many of us have in the healthcare system and in science. And that mistrust is well-founded. There have been so many instances of our communities being abused, misused, misled, that this is what we see as a result. We are reaping that fruit. So we have to acknowledge that history. The health system has to take responsibility for making sure that it addresses all the concerns of people who do have vaccine hesitancy, as they're doing. And I applaud the health system for having this town hall, for the marketing push, for reaching out specifically to different members of our community. But we have to have this discussion about Tuskegee, about Henrietta Lacks, as Ms. Pitt brought up. What's different about this, there is a level of transparency here that we have never had. There are so many eyes and ears and cameras on everything that's happening. And what we're seeing is a vaccine being offered to everyone. It's the same vaccine. It's not Black folks get this one, white folks get this one. I wouldn't do that either. So there are some really important differences here, but you're right. We can't have this conversation without talking about racism.
Great. And I know I wanted to be clear. Some of us are using first names. Some of us are using last names. I just universally was using first so that I don't actually mess up anyone's title. But I've known lots of folks on here know my first name is Rennie, is my nickname, whatever you feel comfortable with. But Chef Dixon is only going to be Chef Dixon from now on. Chef Dixon, my next question is for you. Was there any new information that you learned about the vaccine that led you to the decision to take the shot?
I'm sorry, did you want to start with me?
No. I want to start with Chef Dixon. Will you unmute?
I'm sorry, what you were saying?
Was there any new information that you learned about the vaccine that led you to make that initial decision?
Yes, it was. I was really hesitant, but then I started looking at the information. I came over, I got the literature, and, I talked to certain people who had already got the shot, about, what their feelings was, and, their feelings was the same as mine, moving forward. Where do we go from here? We all need to find a way to get out of this pandemic, and this is one of the ways that we can is to get out. So the information was plain and clear, and and I slept on it. I mean, I just didn't read it and ran over here and said, "Give me the shot." No, it took me a couple of days afterwards, and I felt good about coming over and getting it. So yes.
Nicole Brown, same for you. Was there any new information that changed your mind?
Yes, the fact that no one passed away from it. And also, in the hospital, you see monitors all over, and it's constantly providing the myths, the facts, showing our colleagues and other healthcare professionals receiving the vaccine. So that kind of encouraged me to do it.
Yes, thank you. Kenya, I have a different question for you, but if you wanted to answer that one, you could. Did you have one for that one?
No, yeah, I did. Very quickly, I'll say that the new information for me was, because I told you my initial fear was that I thought it hadn't been studied so long. And when I found out that the foundation for the vaccine really was something that's been in place for a long time, and that there was a lot of research and information from a foundational perspective, and that there was no live virus in the vaccine, that really changed everything for me. So you had another question.
Those are my same. It's funny, Kenya, those were my same too. I think this concept of new is one that we keep hearing, right? And I got that information from Penn, that, we have doctors at Penn who had been working on this mRNA vaccine for 15 years. And I was, to me, pleasantly surprised to hear that, understanding that it is different in terms of the technology that we're using in terms of a clinical trial, but even that this work had been done for a long period of time. So Kenya, you work obviously as our HR specialist, you work with a lot of supervisors. And this question came, as a white provider or as a white supervisor, what would be the most helpful way for me to address this with the people of color that I see and interact with? And how would you advise someone?
I would say that considering what the world has seen, in particular what our country has seen over the last several months with all the social injustice and racial unrest, that you could continue to position yourself as an advocate. And when you position yourself as an advocate, it's really critical to sit in a seat of non-criticism, to create safe spaces where people feel like they can come to you and you will listen. Not to initiate the conversation in such a way that you feel you need to direct the outcome, but considering that there's so much here, there's so much nuance that's kind of rolled into where we are today with the uptake of the vaccine in the BIPOC community, BIPOC being Black, Indigenous, people of color, it's important to listen to why people are afraid. And listening, listen to understand, but also listen to educate and create spaces for awareness, direct them to information, offer it to them first. If someone brings something to you, offer them the opportunity to share information. Is it okay that I share some information with you? I hear your concerns, because validation is important. In particular, for people who don't share your lived experience, acceptance and validation is important. So offering resources, offering information, and holding their hand like Chef John Dixon does, right? Walking them over to, I will never get that wrong, John. I'll tell you about that name later. Sometimes hand-holding is important. Validation is important, in particular for people of color who feel disenfranchised, who don't necessarily feel like they have a voice or that people want to hear what they have to say. So I would say, as a white psychologist, you have the appropriate skill sets to take in information and sit in some really difficult places with people as they take you through their lived experiences. So I think you should consider it a privilege that people would want to come to you, but also make sure that you're a good steward of that position and a good steward of that privilege by always creating a safe, non-judgmental place. Because this whole initiative and activity is not about coercion or influence or overly directing people. It's about creating a space that's safe, where we can share our stories and bring awareness about our lived experiences as people of color. So non-judgment, openness, objectivity, and safety. I think those are what you want to draw on, and raising this issue, raising awareness and having discussions with your colleagues who are people of color.
Fantastic. The next question I'm going to start and take, but then I want to open up to anyone else, which is, what other measures is Penn Medicine taking to engage communities and individuals in an equitable and inclusive way to let them know that this vaccine is safe and necessary? And so I want to piggyback on something that Kenya said. Many of the initiatives that have already been mentioned here today, the screensavers in the hospital that have the folks who've been vaccinated and are wise, and the facts and fiction, are very clearly aimed at one thing. So I want to make that clear. It is about education and debunking miseducation. It is by no means meant to be a coercive tactic. Our goal is to make sure that everyone has the correct information in their hands to be able to make the right decision for themselves. And the truth is, we're combating something that's really hard, which is, on the internet, there's a ton of information that, quite frankly, is just false, right? We just got an amazing, PowerPoint work, run through from Neil Fishman. Everyone doesn't get to have that, right? The ability to have science brought to you. And so what we're trying to combat, and I had to be reminded by my colleague, Dr. Guerra, about what the community needs, we have to answer. And the community is asking us for education. And so we are trying to answer that call to be out there and to be upfront saying, this is fact, this is fiction. And so I'm really proud of many of the initiatives that Penn has done internally, but we also have, a very active social media presence. Penn is moving a ton of the things that are internal to an external space. We have providers who've gone to town halls, to community meetings, who've sent information to church leaders to be dispersed. Do I think we still have a way to go in terms of educating our public? Absolutely. I view our community at Penn, though, as part of the larger community, right? Which hopefully some of this information that's shared today will then be able to go, and we will have those conversations that are no longer the Thanksgiving dinners, but maybe we'll have those in the Zoom calls with our family to be able to share what are the things that we learned that changed our minds, or what are the things that we learned that were fiction that we can now educate our families about the facts, which to me is a major part of this, of these initiatives, is really about education. So Kenya, I'm going to go to you. There's a question about Knowledge Link, right? So if Knowledge Link is a mandatory training program for all Penn Medicine employees, is there a way, or is there any thought about requiring cultural humility training or how to be an anti-racist training in the Knowledge Link, since we have already connected systemic racism and vaccine hesitancy?
So there's a lot of resources that already exist in Knowledge Link that are considered as required. And so a few years ago, we rolled out a program. Shout out to my colleague who's on the conference call, Raina Flory, who's the Chief HR Officer for Princeton, because she did a phenomenal job in 2017 creating our cultural competency program that's listed in Knowledge Link. And all employees are assigned that training when they initially start. And we typically encourage the managers, because it's relevant information, right? Anything worth hearing bears repeating. And so we typically encourage the managers to go out and reassign it to their staff every year, because it's just good information to hear. So that's a resource that we have in Knowledge Link to address issues around systemic racism, racial injustice, and social injustice. And we also just this past summer rolled out our unconscious bias training that was initially geared for leaders, and then it was opened up to the general workforce. And we recently, you should have seen communication within the last month or two going out to you through your email about that unconscious bias training. For those who had the opportunity to participate in the live sessions, it was really impactful and really meaningful work that we were able to do as participants on that, and we learned a lot. And so the unconscious bias training is also available in Knowledge Link. And so I think with the combination of those two workshops and other work that's happening behind the scenes, that's par and part for what we're doing with the vaccine education and awareness, I think those two things are a really good start to address, issues of anti-racism. And then also shout out to CPUP Anti-Racism Committee and the work that we're doing behind the scenes. And this is being one of our first kind of public demonstrations of that work. And also what we've implemented in CPUP in terms of having vice chairs of diversity and inclusion. So there's a lot of work that's happening concurrently and a lot of efforts that are kind of aligning to address issues of racism and systemic injustice and racism. So hopefully that answered your question.
Yes, definitely. Neil, I'm going to ask you a question, which is, first off, can you explain a little bit more about the difference between FDA approval and the EUA? And will Penn, or do we think this will ever happen, that people will be mandated, that staff will be mandated to receive the COVID vaccine?
Okay, so these two vaccines have what's called an emergency use authorization, meaning that the data was reviewed quickly in an expedited fashion, and an approval was given. The data will be reviewed more closely, and additional data will be submitted before the vaccines get final approval. All indications are that these vaccines will get definitive approval very quickly. Remdesivir, which is the only antiviral agent we have against COVID-19, went through the same process. Additionally, had an EUA and now has formal FDA approval. It came about roughly about 3 months after the EUA, and we expect the same with respect to the vaccines. There is no discussion at this point of making the COVID-19 vaccine mandatory because it doesn't have formal FDA approval. I think we need a lot more. We need more data before we consider that. If this is an enduring immunity and really protects people for a long time from a disease that we know is deadly, we will consider it. That'll be something that we will work on with HR. But as of right now, we are not making it mandatory.
Nicole, I'm moving over to you. What can people without medical training or with limited medical training do to support this effort to promote the COVID vaccine in communities of color in Philadelphia?
So like social media is a big platform in order to promote information in regards to the COVID vaccine. Also, if, for example, when I received the injection, I posted my picture on Instagram, and I received so many text messages and DMs in regards to, oh, you did it, so I want to do it too. So it kind of, heightened their wants in regards to receiving the vaccine, which I thought was awesome. And more, the vaccine is becoming available, and I feel like local drugstores, recreation centers, pharmacies, doctors' offices should have all kinds of information that's available for people to receive, whether if it's a pamphlet, a button, something that they can receive in order to get information, and follow their on the websites, go through the internet, read credible resources, so that way they can know what's actually facts.
So Nicole, I have a follow-up question for you since you're on social media posting about your vaccination journey. Did you receive any negative feedback? Was there anyone who said, I can't believe you got this, or anybody who gave you any negative commentary?
No.
Okay.
No.
Anybody on the panel? Has anyone gotten vaccinated and received negative feedback about that?
No. I mean, I posted mine too. I posted my picture. I think you probably saw it. I posted the picture.
Yes, Chef
John. I got a lot of positive feedback. I told him I got the shot. I wanted to move forward. Fear. Fear will never make you move any further. It'll keep you still. And I share a lot. I try to overcome a lot of my fears. I overcame fear of flying. I overcome fear of the ocean, swimming in the ocean. I love swimming in the ocean now. So even, skydiving, I had to overcome a lot of different fears and people know me. I share with the ladies. I said they call me Johnny Blaze because I chase new trails, set new trends. I'm a trendsetter. So, and I just love doing things that, that it makes me feel better now, So, of course I get a little, people around the kitchen, they say little different things, little negative things, but, in the long run, I think they're going to turn around. I really do.
If I could just add in really quick, I received some negative feedback from family members and friends who found out that I had the vaccine. And I just shared this in the chat, but I had to remind them about the tremendous grief that my family has experienced this year due to COVID. Between my husband and I, we lost over 25 people, close family members and friends, people that we interact with every day to COVID. So we've had tremendous grief in a terrible situation where grief, you want to be close to family members and friends and hug them. I can't even hug my family members. We could barely go to any of the funerals. And for me, I had to remind them of that, to say, listen, the risk of getting this vaccine is far less than the risk of what COVID can do, right? And so while we didn't lose everybody we know to death, the downstream impact of having COVID, we have a lot of people that we know who've had it and now have all kinds of residual medical issues. So for us, the risk of getting the vaccine was far less, and the reward was far greater for us. So, I've seen some comments from people who've had similar experiences. They have asthma. I have asthma. I was born with it. I have it still, and I don't want to take the risk of getting it. And so that's been my conversation to people who have pushed back on my decision to get it. And I've also given them information, and I've seen the change in their perspective. So it's worth the fight. It's worth the debate for me with people who disagreed.
I agree with you, Kenya, because when I had COVID, I never had any respiratory issues at all. And then right after having COVID, I did. And now I'm using an inhaler when as needed, because I was having shortness of breath, and it was it was hard for me to talk. And so I get what you're saying. So that was another reason that also encouraged me to get the vaccine.
So you all, in our final minutes, I just want to ask the panelists if there's anything that you want to leave this audience of 718 people. If there's a final word that you want to say that you want them to go home and think about, what would that be? Nicole, the screen is on you, so we'll start with you. Any final word?
Yes. I want you to ask yourself, why shouldn't you get the vaccine? Protecting yourself, getting the vaccine, it brings us a step closer to taking off the mask.
Okay. Dr. Lanefall, final word for the audience.
Yeah, I would say that the question you want to ask yourself is not vaccine versus no vaccine, it's vaccine versus COVID. So if I'm going to take my chances, I'm going to take my chances with the vaccine, because I've seen COVID do too much to too many people.
Risk versus benefits. That's what all of medicine is about, right? It's calculating that risk. Jeff Dixon, final words. What would you like the audience to leave with?
I like them to leave with this search your heart and look at the science, and just think about, your family and friends, because, we lost a lot of family and friends due to COVID. So I would say just look around. Look around.
Dr. Fishman, our CMO, final word.
My 94-year-old aunt died of COVID yesterday. So just let's take this next step together, and let's let this be the beginning of the end.
Kenya Pitt, my co-planner, this is your final word.
I feel like I should have a drum roll or something. Thanks, Jeff. Thanks, Renee. I honestly would just say, ask questions. Don't be afraid. There's no such thing as a simple or dumb question. Ask questions, push back, seek information, search your heart, and look around at your friends and family, and risk versus rewards. For me, I want to be able to hug my sister again. I haven't hugged my sister in 11 months. I want to be able to see my friends again. I don't want to feel like I'm putting someone at risk by just a simple human interaction with them. And so for me, I'm choosing to take the vaccine to be a part of the solution and be able to move us forward towards getting past this virus. And so I would ask you to think about it in that sense, and to think and do the same, and to make a conscious decision that works for you and your family, and honestly for the greater good, because that's really what's important here, making decisions for the greater good and not just for ourselves. So thank you.
I want to thank all of our panelists for your honesty, for your transparency, for sharing such amazing stories with us and with this entire audience. You all, I'm sorry that we did not get to all of your questions. Thank you, Dr. Lanefall, Dr. Fishman, for trying to answer some of them with me. I want to leave you all who have questions that were unanswered. We are available. There are a ton of providers in this hospital system who care about you, who care about your future, who care about your questions. So if you have a question that has not been answered, grab somebody, email us, tell us what it is that we can do to help, again, bridge this chasm of education and miseducation, be able to get you to feel comfortable making the right decision for yourself. And we are going to have our very last word from Dwayne Duckett, our Senior Vice President and Chief HR Officer of UPHS.
Well, first, I'd like to thank everybody for participating. And one of the things in my few months that I'm trying to emphasize in system-wide human resources are the themes of engagement, connection, and respect and improvement. Everything that you've heard today is consistent with those themes. We have an environment that puts the patient at the center, which means that all of you as people are at the center, and we want to show that we care about both our patients and our employees in the deepest way, and want to make sure that people have all the information that they need to protect themselves, their families, and to continue to do the great job that Penn Medicine does. I want to thank everybody for their presentations. It was very dynamic. It was very informative. I learned things. And just keep in mind, this is coming from a place of improving our culture and our environment. And one of the ways that we're doing that is by taking special care with regard to our Black and brown colleagues throughout the system. And this is a very, very significant first step in making sure that we improve the culture and take care of everyone. So thank you for your participation. Thank you for letting me close out. This was absolutely excellent, and very proud to be a part of Penn Medicine.
I can only second that. Very proud. Thank you all.